So hello friends, so now I am going to make a video on the topic of wet gangrene. It is a continuation of a gangrene part. So first of all, that before discussing the definition of wet gangrene, that you should know that so here moist tissues like lungs, mouth, cervix, so here you see that the number of arteries so here supplying this region is high. So now you think so here if any one of the arteries, if in any one, so first of all, that this is a normal situation, basically that all the arteries supplying the so here tissue is normal, that is not obstructed. But in this case, if you see that here, that this side artery basically supplying the tissue is obstructed. As a result, so here blood supply is reduced in this tissue. So therefore basically necrosis occur, and this necrosis followed by gangrene. But this, so here blood vessels supplying the blood to this necrotic tissue is normal. So therefore, and this blood supplies the nutrition also. So that this is the case. But now that is I am going to tell basically why that is wet gangrene occurs mostly in the moist tissues. So just remember, it is not that. So first of all, if you see here, that is the, so now basically why is the amount of bacteria invading the necrotic so here necrotic tissue more than the so here dry gangrene, because so here in dry gangrene I discussed, so here basically the amount of bacteria invading the necrotic tissue less, but here it is high. Why? So first of all, that as I've already discussed, so here basically in the moist tissues like lungs, cervix and mouth, the number of arteries so here supplying blood, so here the number of arteries so here supplying blood is high. So here, and the second point, so here, and you can link from here, basically if any one of the arteries so here supplying the necrotic tissue is obstructed, so here you can see here, then so here it leads to coagulative necrosis or liquefactive necrosis. Now so liquefactive necrosis, and here a liquefactive necrosis, but as I've mentioned, that is there are many arteries supplying this blood vessel, supplying the tissue, but in some of the arteries the blood supply is normal. As you can see here, that is I have mentioned, that is a blood, so here this blood supplies the nutrition, and due to that normal blood supply, from that normal amount of blood supply, that is the required amount of nutrition required by the bacteria also enhance. So therefore basically in this wet gangrene, the amount of bacteria invading necrotic tissue is more. So friends, now you see here, so here that this artery so here supplies nutrition to this, and from these arteries also basically blood will go into the vein. But here that is if any obstruction occurs in this vein, then this blood will not go here, it will be stamped here, and due to this region also you will find that in this so here coagulative, so here in this necrosis also basically that this blood also basically trap or stuffing of blood occurs, and slowly this leads to development of liquefactive necrosis also, and the deposition of bacteria also leads to so here development of liquefactive necrosis. So friends, as you can see here, that due to the blockage in the artery, so here due to blockage in the so here vein also, that is wet gangrene occurs, and it occurs in the moist tissue, so here like lungs, cervix. So therefore I have written, so here that gangrene occurring in the moist tissues due to venous or arterial blockage is known as wet gangrene. And here all these things mentioned in your book also I am going to show that. And here also this is a diagram. So here basically that is lungs is supplied by more number of arteries. Just I made a rough diagram. So friends, so now you can see here basically definition. Wet gangrene occurs in naturally moist tissues and organs such as the bowel, lung, mouth, cervix and vulva, etc. And you can see here that is it occurs from blockage of both venous and arterial blood flow, or here mainly it occurs due to blockage of venous drainage. So here, and it's the most important part, the affected part is stuffed with blood. So here basically stuffed with blood, that means as I mentioned here, so here you can see, so here this is the blood, and this blood from artery has to go into the vein, but here that due to this obstruction or blockage in this vein, it will, sorry, the blood will not go from here to here, that is in this direction, it will stop or trap here. So therefore, and that covers this point, that is the affected part is stuffed with blood, and this favors the rapid growth of putrefactive bacteria. And why putrefactive bacteria, as I mentioned, because so here that is the required the amount of blood, so here supplies the required amount of nutrition to the bacteria also. But in the earlier case, so here that is bacteria don't get enough nutrition, so therefore they don't survive. But in this case bacteria get the nutrition, so therefore they survive. Are the toxic products formed by this bacteria also. Now that is I'm going to explain basically why these two parts also, that is diabetic foot, as I mentioned basically that in the distal limbs, so here that is dry gangrene occurs, that is wet gangrene does not occur. But why, I'm going to explain that. So friends, that you should know that diabetic food, that means a person has diabetes mellitus, so high glucose content, and this high glucose favors the growth of bacteria. And here now the bed source, so here bed source, so here bed source, that means pressure is high. So here due to this high pressure, so here basically the arteries supplying the regions like heel, buttocks and sacrum obstructed. So here obstructed, so here just like this, so here obstructed, so here as a result bacteria grow, that is yes, so here some of the arteries obstructed but not, so here basically necrosis occurs, but bacteria grow because of the that is in the remaining arteries while blood supply is there. So friends, so now I'm going to explain about so here basically that is the gross structure. So here friends, you can see here, so here that these are the affected parts, and these are the affected parts, and here basically that these are the non-affected part. But here that in some cases that you can't easily see in the, so here basically a well line of demarcation. So therefore that is a point here basically, or here if it is seen also, but as compared to this dry gangrene also it is not well seen. So therefore no that is where line of separation formed between the fival part and the gangrenous parts. And here simply also that as I have that is mentioned, it is white is black in color simply due to formation of black iron sulfide, and here black iron sulfide formation as I've already mentioned here in the previous part also. So here also, so simple. Now I'm going to explain about the histopathology. It is very important. So here, and you can see here that this is a coagulative necrosis, and you can see here as I have mentioned, but the most important thing here is that these are all the inflammatory cells which are found. These are inflammatory cells, and these are the stuff. So here that is basically artery, or here are blood, arterial blood, and here due to this basically bacteria grow. And here these are the main regions which are explaining the histopathology, and these are mentioned in your book also. So here, and you can see here that this is the, so here necrosis, so here that is necrosis, and here and this inflammatory reaction and numerous bacteria, and no clear line of demarcation at the junction, or if it is seen not very well. And here and the mechanism as I have already mentioned. So here basically that this is the region. So here that is how is the amount of bacteria that is increases. And here it explains where it occurs more, and this is the region that is putrefaction, and this is the no clear line of demarcation, or as compared to previous one it is less. And here, and the last part that I want to explain is about the gas gangrene. But gas gangrene is simply basically a type of wet gangrene, because you know that in wet gangrene use that is bacteria present, but in case of gas gangrene, the bacteria which is present is the gas forming Clostridia. Thank you. That's all about.